Okay, welcome to today's Health Anxiety Masterclass. If you've been stuck in health anxiety for months, if not years, you'll want to watch this. So today, what I'm going to be going through is what's keeping you stuck? Like, what are some of the common mistakes that people make that keep them stuck, fearing their symptoms, thinking that their symptoms are a real health problem, and also stop you from going down the rabbit hole of getting dozens of tests or constantly questioning if something is wrong with you. So, if that is you, you're in the right place. The Health Anxiety Masterclass, why you stay stuck and how to break the cycle. Let's get into it. So, what you're going to learn today, why health anxiety feels so real, the cycle that's keeping you stuck, the biggest mistakes I see people make, and I've worked with hundreds of clients with health anxiety, so I've seen a lot of mistakes here, and what recovery actually looks like. Okay, so a little bit about my story. So my journey with health anxiety started when I took a weed edible, right? So I'll do it this. I took a weed edible and I had a crazy panic attack and my heart went absolutely crazy. It beat uncontrollably. I was convinced I was having a heart attack and it was a really traumatic experience. And then what happened after that is I sensed, like, from that panic attack, my nervous system was sensitized, and I had a panic attack 6 days after that night, and I ended up in the emergency room with what I thought was a heart attack. My heart just randomly started beating uncontrollably again. I was like, right, there's something wrong with me this time. So I went to the hospital and they checked my heart and nothing was wrong with it. But from that moment onwards, because it was so scary to experience those heart palpitations and that panic attack, I became afraid of it happening again. And as a result, it started happening again and again and again. And I went to the hospital 2 more times that very month. And I had all sorts of tests and nothing came up. They just said it's anxiety, and I didn't believe them. And then from there, it manifested into other types of health anxiety. Like, I thought I had a brain tumor and I had tests on my brain. They didn't find anything because I was getting these symptoms of brain fog, DPDR, brain zaps, feeling constantly tired. I was convinced I had a brain tumor, and I saw other people in the media, get diagnosed with brain tumor, so that became ingrained in my brain. And also other types of cancer was something I worried about, but it was a nightmare. For years I was convinced I was just going to drop dead because I was experiencing these severe anxiety symptoms that I mistaked as a real threat to my life. And it wasn't until I learned the method that I'm going to teach today that your therapist probably hasn't taught you, because my therapist didn't, and I've worked with so many clients who've had such poor advice from their therapists. I'm going to clear up things for you today. So let's get into it. Okay. So, the health anxiety cycle. So let's look at this. So what usually happens with people with health anxiety is there's a physical sensation and then there's a thought. What if this means something is seriously wrong? What if there's something wrong with me? What if this is real? What if I'm going to drop dead? And then anxiety increases, right? Symptoms get stronger. And then there's some sort of behavior, safety behavior, checking, monitoring, Googling, reassuring yourself, doing something when the anxiety is present, right? And that gives you a sense of short-term relief. It gives you, okay, well, I've had this before, so it's okay. Or I've checked my pulse, my heart's still beating. Or, oh, I've just Googled this symptom, this can be just anxiety, right? And then the brain learns that these symptoms are important. When I get these symptoms, I need to do something. Therefore, it's dangerous. If I didn't do this behavior, then something bad might have happened. That's what the brain thinks. And then the cycle continues. And then you get your next symptom, your next trigger, your next thought, and then it's just rinse and repeat. So most people think, if I can get rid of these symptoms, I'll recover, right? Recovery is actually breaking this cycle. Not eliminating the symptom, not eliminating the trigger, not getting rid of any of the anxiety. It's relating to it differently. So a big mistake people chase is they try and get 100% certainty, right? They do this by Googling. when they're anxious or when they think they've got something wrong with them. They go to so many different doctors and they get various different tests, right? And then the tests come back, the blood tests come back, the MRI tests come back, and there's nothing wrong with them. There's nothing that the doctor can find, right? But the problem that people have is they then think, well, how do I know if the doctor picked up the right test? Or how do I know that the doctor is competent, right? And then there's this need for 100% certainty that will never exist, because you can never truly get 100% certainty, you know? And I've talked about here, there's no level of reassurance that permanently satisfies health anxiety. Let me say that again. There is no level of reassurance that permanently satisfies health anxiety. You can get the best doctors in the world, the best, most advanced tests in the world, and it won't be enough, because there's always a what if thought attached to it. Okay, it's fine now, but what if cancer develops in the next few months? Or my heart was beating fine on that ECG, but maybe in a few days there will be an irregular test that will give it away. There's always a what if, there's always a but, right? But you can't be 100% certain. There's no doctor or no test in the world that can say there's 100% no chance that you have a illness. And that's what keeps health anxiety alive. It's the need for 100% certainty, because there is a small chance that there could be something, even if all the tests point towards it. And that is enough to keep someone anxious around their health. So you need to make peace with the worst outcome and make peace with uncertainty and be, okay, I'm not interested in whether I have this or that. I've done all the due diligence, I've done the testing, and that's enough for me, and I'm not interested in anything else, right? So you need to develop a new relationship with uncertainty. So another mistake that people make, right, because let's be honest, most people with health anxiety don't have a health problem. Let's just call a spade, right? The majority of people, I don't want to give you a statistic because I don't have that statistic, but the majority of people who have health anxiety never end up having the illness that they worry about, right? Because generally, it's because it's anxiety, right? And what I say to people who join my program, clients that I've worked with, I've helped hundreds of people break the health anxiety cycle. And I ask them questions like, when did it start? Like, what stress was going on? Like, was there a lot of stress? And usually for people, for clients who I work with who have health anxiety, there's usually a really stressful time in which the trigger started coming up, right? Whether it's a lot of exams, whether someone was going through a divorce, whether it's, you know, someone died in the family, or one of their friends died, and suddenly they sort of think, oh, that could happen to me, right? There was some sort of acute stress or stressful period that triggered the worry, triggered the health anxiety, and that's usually the case. So that's, to me, evidence that this is just anxiety. And also questions like, does it come and go? Because if it is a real health problem, you know, it wouldn't just come when you're stressed. It wouldn't just come when you're worried. It wouldn't just come in waves. It would be persistent, right? Another thing, does distraction reduce it? If you're not focusing on anxiety, focusing on your worry, is it there? Because again, real health problems don't go away if you stop worrying about it. They stay. It's constant, right? Does worrying increase it? When you focus on the illness or the problem that you think you have, does the illness, quote unquote, the symptoms of the illness, quote unquote, get more severe? And does it appear in specific situations when you're triggered? Because all these things point towards you having health anxiety. And you've got to understand that a dysregulated nervous system can create crazy symptoms, right? You know, it's once you've done the tests, you know, once you've looked at the pattern and understood, okay, well, it's happening when there's acute stress, you know, you've got to understand that the nervous system can create crazy levels of symptoms, right? Heart palpitations that feel so much like a heart attack, right? the brain fog, the brain zaps, it feels real. But anxiety has a huge, significant way of creating real symptoms that feel real. Okay, so it's helpful to start putting all these symptoms and sensations you're experiencing under the umbrella of a sensitized nervous system, under the umbrella of anxiety, right? Instead of a brand new medical mystery, right? It is helpful to do that. This is anxiety. So another mistake that people make, right, is they feed the symptoms. So they monitor their symptoms, they check, how's my heart doing, how's my chest, how is my brain, how's my throat, right? They analyze it. They think, okay, is it bad, is it not? They compare it to what it was earlier, what it was before, right? They check it again, constantly checking. They Google, they reassure. They focus on the symptoms and they try and do something about it. They try and monitor it, regulate it, right? You're not a doctor. You're not a doctor. It's not your job to monitor it. And honestly, it's just making it worse. It's making the anxiety worse. You're telling your brain every time you focus on your symptoms that you think is a health problem that these symptoms are important. Therefore, your brain sees it as a threat. So it produces more anxiety, more symptoms. Remember, attention is fuel. The more attention you give symptoms, the louder they become. Not because they're becoming more dangerous, but because your brain believes they're important. And this is another thing people do with health anxiety. They turn every sensation into a story. So the heart starts racing, I'm having a heart attack. There's a headache, it's a brain tumour. Dizziness, I'm going to faint. Every time you give power to these intrusive thoughts that come in, you're making yourself more anxious. It's okay to experience thoughts of, what if this is a heart attack? What if this is a brain tumour? What if I'm about to faint? That is something you can't control. But what you can control is whether you focus on it, whether you actually give that story truth. It's like, I can experience those thoughts and do nothing with them. Not go, oh yeah, that's true, or I need to do something about this. It's like, let it be there. Disengage from that thinking. Focus on what you're doing in the present moment. Take your attention away from those thoughts and put it back to what you're doing in the present moment. Don't try and push them away. Let them come up, but don't focus on them. Because remember, your attention is your fuel. So stop. Just because you're experiencing symptoms doesn't mean it's a heart attack. Doesn't mean it's a brain tumor. Doesn't mean you're about to faint. Right? And another thing that anxiety does is it treats every symptom with so much urgency. Right? And that's how you know as well it's anxiety, because if you had a real illness, it wouldn't require so much urgency. Anxiety makes you believe it is urgent what you're feeling. Like, I need to know right now what this is, or I can't relax until I know that if this is something real or not. Right? But you've got to understand that that's how anxiety thrives. And part of the way you really break the cycle is by showing to your brain that you don't need to act on the severe symptoms. It's like, okay, I'm experiencing this, and I let go of needing to know. I let go of needing to know exactly how this plays out, which is scary, right? To surrender, to not do anything, to carry on doing what you're doing and not play the game anxiety wants you to play, of trying to get certainty or trying to reassure yourself or trying to get some sort of doctor's opinion. It's scary to let go of that, but that's what's required to break the cycle. And another mistake people make is avoiding their triggers. They stop exercising because it raises their heartbeat. They stop going to busy places because it enhances their dizziness. They stop driving because they start to feel symptoms more severe. And then they stop traveling because when they're on a plane, they feel more breathless. They feel more trapped, right? And every time you actually avoid these situations that trigger your health anxiety or that increase your health anxiety, you teach your brain that I escape danger, right? Whereas exposure, when you know how to do exposure the right way, and this is one for another day, it teaches your brain, I was safe all along. I didn't need to avoid that. And I'll go into this. This is what recovery looks like. So right now you're probably experiencing a sensation, you're panicking, you're checking to see if it's real or not, you're seeking some sort of relief, whether that's a beta blocker, whether that's some sort of reassurance, whether that's some sort of Googling, whether that's some sort of checking your pulse, and then you repeat it. Recovery is the opposite. It's experiencing a sensation, letting it be there, experiencing an intrusive thought of what if this is a heart attack, not even engaging in it, carrying on doing what you're doing. If you're driving, you're driving, then your brain learns it's safe. And then because you no longer give them focus and importance, and you don't stop yourself from trying to feel the severe anxiety, symptoms gradually lose their significance. That's really how recovery happens. So the SAFE method, this is what I teach all my clients. It's stop engaging. Stop engaging in the thoughts, stop engaging in the behaviors, the safety behaviors, the reassurance, the Googling, allowing anxiety, the thoughts, the symptoms, not trying to get rid of them, not trying to distract yourself from them, letting them be there, but without focusing on them. Face what you've been avoiding, getting in the car, going in a plane, whatever triggers health anxiety, and then expanding your life, making this your new normal, making doing what you want without health anxiety or not the new normal. And this is this is the framework I've used to help hundreds of people. And yes, this is a very brief explanation of it, and there's more to it, but these are the fundamentals. So the biggest thing to remember, you don't break the health anxiety cycle by eliminating symptoms. You recover by stopping your brain from training every symptom as a threat, right? So that is the important thing. It's no longer fearing the symptom and letting it be there without practicing out the compulsions, without focusing on the thoughts, the story, what if I have a heart attack, and just cracking on as you are. That teaches your brain that it's not important. So you can recover, right? I've done it, and I tell you what, I'd be lying to you if I said it was easy, but I know it's possible for anyone who's committed to this process, who's willing to face their fears, who's willing to let themselves be in that uncertainty, who's willing to disengage from the worrisome what if thinking, right? It's possible. So if this resonated with you, leave a comment, leave a like, make sure you subscribe because I'm posting regularly on YouTube. But if you want my personal help and you feel like, actually, I need someone who's going to hold my hand and really keep me accountable in this process, send me a message on Instagram, rewire, and I'll be happy to share how I can help you on a personal basis. I've helped hundreds of clients break this cycle. So send me a message, rewire, on Instagram. And if you want to watch more videos like this that will help you break the cycle, I'm going to put some videos here that you can click now. And I hope you've got a lot of value from this video, and I look forward to seeing you on the next one.